All right, ladies and gentlemen, welcome to this technical webinar series on wash, waste, and electricity and healthcare facilities hosted by WHO and UNICEF. Fantastic to have you all with us, and really great to see a good number of participants on the call this morning, already up to 60, some of you. I'm sure we'll have more joining us as we go on. My name is Lindsay Denny, and I am work for UNICEF and the Healthy Environments for Healthy Children program, looking at environmental health and in particular, wash, waste, and energy and healthcare facilities from a climate resilience lens. And I'm excited to welcome you all to this session. It's the second session in the technical series. We did one 2 weeks ago on Wash Fit. Today, we'll be talking again about healthcare waste and green technologies. And then in a couple of weeks in 2024, we'll have sessions on costing. We'll be talking about solarization and additional sessions in this technical series. So thank you again for joining us. I am delighted to be joined by several experts on healthcare waste today. We'll be giving an overview presentation on healthcare waste management and particular green technologies. Then we'll hear from UNDP and their experiences in developing a program around this. And then we'll have an opportunity for you to ask questions to experts, including colleagues of mine at UNICEF, about how you go about addressing this topic. We, of course, have talked about waste management as a facet of WASH for many years, but it was really around the COVID-19 pandemic and the abundance of waste that was being produced and then needed to be dealt with, treated, and disposed of, that this really became a topical issue. And we're starting to look at it from a separate lens in the WASH and healthcare facility space to see how we specifically address this unique challenge. So very lucky to have with us today Dr. Ute Pieper from WHO. She is a consultant on healthcare waste management and one of the premier esteemed colleagues who is very much well-renowned for her healthcare waste work. So Ute, I'd like to hand it over to you to start us off with an overview presentation on this topic.
Thank you very much, Lindsay, for these kind words, and welcome everybody to this session. Yeah, I'm happy to provide a short intro to this subject. As you all know, when you go into healthcare waste management and you get deeper and deeper, it's getting more and more complicated and with a lot of different areas and levels. But here we really would like to focus on green technologies and the related climate change as well. This is also my first slide. Next one. So I've just 2 slides with key facts. So one of them is based on a study which has been issued in 2019 by IRUP and Healthcare Without Harm, the healthcare's climate footprint. And one of these results was that healthcare climate footprint is 4.4% of the global total. If the global healthcare sector were a country, it would be the 5th largest greenhouse gas emitter on the planet. So that means we do see really the whole life circle here, right? For healthcare. So we do not see only the hospitals, the health facilities itself, but we need to see the whole circle from the production, transport, electricity, all the bits and pieces which are feeding into this subject. And based on that, it would be the 5th largest gas emitter on the planet. This is really incredible. And when we just go further, next one. So when we see the greenhouse gas emissions worldwide, so what are the primary sources of greenhouse gas emissions? In 2019, well, this is not surprising. We have electricity and heat on the first rank. Then we have transportation. We have manufacturing and construction, but also waste is there. You can see this a bit lower on the 9th place. The waste in specific, it has 3.2% of the global greenhouse gas emission. This is still incredible, a lot. And when we talk about waste, you might think of, okay, what are the main greenhouse gas emissions when we talk about waste? It's incineration. Of course, it's incineration, it's open burning, a big influence on the greenhouse gas emissions. But it's also landfilling. So the methane from the landfilling is a big proportion of greenhouse gases produced by waste management. Next one. So when we talk about climate and green technologies, so what are the factors? How to select treatment technologies? So first of all, of course, you have to see your national regulations. You always have to be in line with the national regulations. And then also the international regulation, in case you don't have the national ones or you want to have something additional, you have a look at the international regulations so that you have a framework where you can embed your treatment technologies. Then you have to see the environmental and occupational safety factors, of course. And important also is the type and quantity of waste generated. In this presentation, we are talking mainly about sharp and infectious waste. And I don't know how many of you or your experience that the facilities are really measuring their waste, so that you really know exactly how much infectious sharp waste you are generating. This is a big weak point in the global system, I think. And it's when you don't know exactly how much waste you're generating, it's really difficult to find the right equipment or the right capacity of the equipment. Then also the budget is very important. So, and here we are talking not only about the investment, but we also talk about the budget needed for the operation, for sustainable operation and maintenance of the equipment. Then you need sufficient space and infrastructure. So the infrastructure is, of course, the housing, but also the available energy and the available disposal options. A good source to have a closer look on the different technologies is applied on this slide. It's the overview of technologies for the treatment of infectious and sharp waste from health facilities, which has been published in 2019 from WHO. So this is available also in different languages. I really recommend to have a look there if you want to have more information. Next one. So here we have the hierarchy of waste treatment options. This is also taken from the document I just referred to. And we are today talking only about the upper one, the low heat based processes, so namely the autoclaving and microwaving technologies. Next one. So starting with the vacuum autoclave. So talking about vacuum autoclaves, it is important because the vacuum really ensures that the air out of the system is sucked away, so that there's no air in the chamber anymore, and that all waste can be in contact with the steam which is inserted into the system. This is important, and this is why WHO is recommending to use a vacuum autoclave instead of the gravity autoclaves. So the process is based on heat and the vacuum and steam. So the waste is decontaminated at temperatures between 121 to 134 degrees. By doing this, all the germs and pathogens are killed. And after the autoclaving process, the waste is decontaminated and is considered as normal, non-hazardous waste and can be disposed as such. So here we are coming back to the question how to select the correct or the best treatment technologies for your situation. The disposal option is always really important. So really, because when you dispose this waste on an open dump site, there might be scavengers going through the waste, or also the municipality might not be willing to take this waste because they don't trust this technology. So the disposal of the waste is always one factor you have to consider when you select the treatment technologies. Then you also have to keep in mind that this kind of technology is often using a three-phase electricity connection, so 380 to 400 volt. In the most cases, at least the bigger devices, the smaller ones, the tabletop ones, to also work with 240 volt. But this is an electricity connection you have to provide. And it should be there on a reliable base. And not all facilities do have these electricity connection available. Also, the reliable water connection and the specific water quality, the soft water to protect the autoclave itself is important. Next one. Another possibility is also, again, an autoclave, but in this example, we see an autoclave with an integrated shredder. So that means that the waste is getting into the system, it is shredded, so rendered into small pieces, and then it is autoclaved. In these systems, we do not need necessarily a vacuum system because the waste is already put into small pieces and the steam can easily get to the surfaces of the waste. So there are advantages. So you can see here on the bottom of this slide the result after the treatment process. So you see the waste is really put into very small pieces. They are not recognizable anymore. The scavengers on landfills cannot use this to resell it or to use it in another fold. So it's very good for the disposal, and also the volume is much smaller than the autoclave without shredder. On the other hand, of course, it's more expensive. The investment, maintenance, and operation is more costly. It also needs 380 or 400 volt electricity connection and a reliable water connection. Next one. The next and last one I would like to introduce here is the waste microwaves with shredders. So microwaves are using, like it says, microwaves to heat up the waste. So it does not use the external steam connection or steam production. It uses microwaves to heat up the humid condition of the waste. The newer microwave systems even have some water connections where they put some additional water to the waste in case the waste is too dry, so that the microwaves can heat up the waste up to 110 degrees. And then it is stored for another half an hour for these temperatures to ensure the full decontamination. So again, these systems use three line electricity connections, so 380, 400 volt electricity. Again, the shredders are expensive because you always need shredders with microwaves, or in the most cases. It's really only a small amount of water which is used, which is a very big advantage for a lot of settings. And again, you can see also here the result after microwave with shredding. The waste is rendered really into small pieces. The disposal is not a big problem here. Next one. Here I just would like to show you, when we talk about green technologies and also the electricity consumption is important here. This is a comparison between a microwave with shredder and an autoclave without shredder, just to highlight the differences, because what I told you before is, of course, to use a shredder has a lot of advantages, especially for the disposal and the reduction of the volume. But on the other hand, we really have to consider the electricity consumption and the costs which are based on the electricity consumption. So on the left hand, you can see the microwave with the shredder. We have which I marked here on the right side. It's a 500 kg chamber of this microwave per kg per cycle, and the energy consumption per cycle is here 100 kilowatt hours per cycle. On the right hand, you have an autoclave without shredder, and you can see with the same capacity, with again 500 kg per cycle, you have only 400 kilowatt hours per cycle. So you can see the difference. Yeah? And over the time, and the year you will you have to calculate before you start selecting these technologies how much electricity you have, how reliable your electricity connection is, and also again coming back to climate. Of course, the more electricity you use, depending on the kind of electricity, the more climate relevant these technologies are as well. Next one. One possibility is to reduce the electricity, especially when we talk about where is the electricity coming from. When you use electricity produced by coal, for example, it's a different matter. Or if you produce this electricity by solar energy. So here we have an example where a UNDP JEF project in Africa, where WHO was partnering, was purchasing a solar panel for a health facility where an autoclave was installed. So there was an 80-liter waste autoclave in a referral hospital. The housing was constructed, electricity connection with a 3-phase electricity connection, water connection was there, everything was there. And then at the end, the health facility said, okay, we really have a problem with the electricity. We do not have sufficient electricity. So the project provided solar energy for 3 kilowatt capacity. And it was installed in 2018, and the result was that 25% of the total electricity, including the autoclave, covered the solar panel for the hospital. So this is a good example for the playing around with green energy to save carbon emissions, and to use alternative treatment technology also to save energy, to save money, but also to save greenhouse emissions. Okay, thank you very much. I think this was my last one. No, the conclusions and recommendations. In general, when you talk about green technologies, think out of the box. Before you go for the treatment technologies and higher capacities, think of how can I minimize or recycle the waste? Can I use reverse logistics to prevent on-site waste treatment? Can I connect my waste treatment to another hospital which has already a treatment system? Can I use solarization for the equipment I'm purchasing? Assess the local situation. So what is your capacity on water, electricity, space, capacity, budget, human resources, space, and so on? Are alternative treatment technology a solution which is really affordable for you, because it's really preferred, because it does not have greenhouse gas emissions, there's no hazardous ash in comparison to the incineration technologies. And keep in mind that technologies with integrated or post-shredder uses more energy, but can be really easier to use because the volume is reduced and the waste is unrecognizable. And always not only see the investment cost, but also the operation and maintenance costs at the end. Okay, thank you very much for listening. I'm happy to answer questions later on, so I'm still here. Thank you.
Thank you very much, Ute, and great to see. I think you have a list of all sorts of technical resources. So just to emphasize that there are a number of places you can go to get additional information. Certainly, we've talked about the key resources, the key guidance documents from WHO, but there are additional websites, infographics, trainings, tools, courses, etc., that could give you more information on all kinds of wash and healthcare facilities issues, as well as waste and healthcare facilities. So thank you so much for that summary and really reminding us of the various technologies that are available and the pros and cons of using them. I think it's helpful to think about there is no one-size-fits-all solution for healthcare waste. It really is going to depend on the context, on the resources available, as well as on the facility type itself. So I think keeping that in mind will be really useful. And with that in mind, I'm pleased to introduce our colleagues from UNDP, Vadia Darmawi and Manish Pant, who are coming in to talk about healthcare waste and green technologies in Indonesia, looking at a firsthand experience of how they've developed and utilized the green technologies. So if you have questions, please go ahead and drop them into the Q&A. We will have time after this to address any questions you have and hear more from the speakers on their experiences. So Vadia, over to you.
Yes, thanks, Lindsay. Hi, everyone. So I think that I agree with Ute in the previous presentation that one of the key things is how we can how can we offer solutions if we don't know how big its problem and the variety of the problem itself. So I think that this is very relevant to that point. So in Indonesia, we're trying to offer the government on the solution of monitoring the waste that generated by their health facilities with the digital solutions. So this Smile is one of the digital solutions that offered by UNDP across the country and in Indonesia. It started with the COVID-19 vaccination, where the logistics system, monitoring system across the country was offered or assisted by UNDP. So we can track the distribution on this vaccine logistic to 13,000 health facilities that across or spread across 38 provinces and 500 districts in Indonesia. There are around 700 million doses now that we can monitor or record it in the Smile. So next. Nationwide, the vaccination and health services also pose Indonesia extra burden to the infectious waste in the country. So the burden of our waste is not shared equally around the country because it's mostly concentrated in Java Island. And half of the health facilities are actually located in outside Java Island. But those islands rely on and exported their waste, including infectious one, to Java Island to be treated. And on the other way around, people lives in Java have no control what has been contaminated and has been brought into their island. So I think this is very pose the everyone into a risk, environmental risk, because the visibility on how many waste was generated is not possible now, and the poor waste segregation, it cannot be monitored because it's inside the health facilities and we have no control on that. And also the reporting that's supposedly reported by the health facilities to the ministry is always delayed, and there is an unmatched treatment capacity and waste burden because no one knows what has been the problem or actual waste generated by all the hospitals and health facilities across Indonesia. And also this waste management was handled by two different ministries and the private companies as well. So in short, we are not confident that the country has delivered proper management and control of this waste, and it potentially has been threatening human and environmental health. So next. Okay, so next, this is why Ms. Mal stepped in. Next. So taking into account UNDP excellent work in vaccination, monitoring, and supply chain management, so the Ministry of Health, again, would like UNDP to help them to ensure the health facilities are managing waste that generated by them and can monitor them, and ensuring also that they are disposed in a safe manner or properly reused. Next. So this MISMAL is not a smart application, merely smart application, but it's actually a system because it also incorporates a combination of IT, capacity building at national and subnational levels, human resources development, and also we are trying to have effective decision making based on the data presented in this MISMAL. Next. So what are the key features and how we can keep tracking the waste in real time? So there is a QR coded waste bag, allow the system retain the information of type of waste inside the each bag and keep the bag intact. And those information send directly to the cloud server. And so the bag containing reused and also recycled materials will be identified from this QR code before they enter the incinerator process. So inadvertent disposal of waste into incinerators that could have been reused or recycled will be minimized, and it will result cost efficiency and also minimize environmental health. And in addition, all information of waste bag from the hospitals during transporting, arriving at the treatment site will be sent directly to the server and to the dashboard in real time. So the information gap between what happened in the field and also what the decision makers have to do is can be closer, and delay of information can be avoided. And next. So the supporting policies, we have the global and also the local policies that regulated by two different Ministry of Health. They are really keen to track the infectious waste from their health facilities until they're disposed. In other way around, the Ministry of Environment would like to make sure that the waste are properly managed by health facilities. So it's quite nice of UNDP to offer support in reference to global and local regulation that the real-time data from the hospitals to disposal sites in MISMAL will feed into decision-making process between these two line ministry. So the data will be interoperable and can be presented to those ministries without any gaps. So next. This is the MISMAL technical guidelines that provided the Ministry of Health and also supported by Ministry of Environment. Next. So this is one of the cover of the guidelines. Next. So we roll out MISMAL in 3 pilot sites in 2022 to see how it goes. And after that, the Ministry of Health is quite satisfied with the results, and they want to know also the variety of the waste management across the hospitals because they are different one to another. So they decided to have another pilot sites into 30 hospitals in 2023. And those hospitals are mostly big and national education hospital in Java and a few in Sulawesi Island. So technical guidelines and trainings also provided by MOAs for users. This is very good a sense of belonging from the Ministry of Health. Next. So through MISMAL, the Ministry of Health now is able to regularly monitor the quantity of waste from the hospitals and track from transporter when they picked up the waste from hospital to disposal site. And next is, or later, they will ensure the storing days of waste are not passing the time limit because it will show in the dashboard, empower the waste handler refining standard and procedures of waste management. All of this information is recorded and can be accessed real time through the dashboard at the national level at the Ministry of Health, and it's part of the integrated data system. Next. So although MISMILE has just been implemented less than a year, the government of Indonesia is now able to have a visibility on infectious waste in these sites. Like 1 ton per day in hospital, they can see that, they can monitor that, and also 20 kilogram per day in community health centers. So this is one of the differences between hospital and health centers. And the capacity of treatment, if we can see from the estimation from the Ministry of Environment, they said that the infectious waste can only be treated up to 250 tons per day. That's the capacity of the treatment facilities. But if we can see that from the estimation of 1 ton per day per hospital, that the capacity is only 10% of total estimated medical waste generated by all health facilities daily. Next. So this is one of the dashboard that can be fitted into the that can be presented by the users to the users. Next. Next. Sorry. So SMILE can also give the measures alert system. Next. So this is the achievement in numbers that I presented before, that 1 ton per day. Next. And this is one of the interesting part that MISMILE can provide end-to-end standard operating procedures from the experience and also the model from the 30 sites. Now it can be because there's differences on the availability of treatment and sterilization machine inside and outside hospitals. So this unique and variation in business process workflow of waste management in Indonesia has been incorporated into the new standard operating procedures. So hopefully in the futures, MISMILE can be customized as per need and could be implemented in a variety of waste management flow across health facilities in Indonesia. Next. So the initiation of MISMILE that resulting that reporting rate and also complete report has been maintained 100%. And the system itself has shortened the duration of weighing process during waste loading in hospital from 3 hours to half an hour, and increase the accuracy of measuring of weighing because we use the digital weigh, and the waste was weighed during the collection, transporting, and later during the pre-disposal process. So everything has to be matched. If there is an unmatched situation, then it could be increase the alert system into the dashboard. Next. So this has been a very good benefit for Indonesia because of that we have been the cost efficiency and everything should be managed, that we can prove the digital solution can lead to cost efficiency, less harm to environment because the reuse and recycled materials have been segregated and now can be identified easily through QR-coded bag before they go to incinerators, and ability to identify them when they found in any where that before the incinerator sites. And the conducive regulatory framework has been endorsed, and hopefully there are more control to waste. Next. So what are the key uptakes from this MISMAL or the solution that has been provided by the country? So that implementing SMILE is it's very important to have the government engagement since the beginning, because we have to ensure that the government ownership of MISMAL system and also can retain it or sustain. So we have to understand the needs of the government and offer tailored solution. There is a original SOP or technical guidelines in the beginning, but after 1 year, we know that there is a variety of need or variety of business flow in the waste management within the health facilities. So we update the SOP and also we customize the application themselves. And strengthen the capacity of procurement of software. We have to make sure that the software is owned by the government, so it's not licensed, it's open source. That's very important. And these field-based sanitarian is and the transporters, we train them, and then we'll be the best advocates of the system once they are feeling comfortable using the system. So they will talk to each other, they will communicate from one hospital to other hospital, from one province to other province, that they're comfortable with MISMAL and they can control their waste within the hospital with MISMAL, and then other will be following that practice. So UNDP Indonesia, fortunate that UNDP has proved how robust SMILE was during COVID-19, but I think that if you want to adapt SMILE, so you can see the model from our country, so you can tell your government that don't be afraid that the digitizing the medical waste is infeasible or impractical. Actually, they can do that. So I think that that's my point of how the country, Indonesia, is doing on managing their waste. So I think that if the time allows, we can play the video, if possible, how it goes.
Yes, let me just pull that up. One moment. Wonderful. Thank you so much to the UNDP colleagues for sharing their experiences. Really interesting to see the work that you've been doing there. I'm going to ask Isabel to just give a brief introduction to the UNICEF work, and then we're going to be open for questions. I see a really robust Q&A going on right now. So feel free to add more questions, and then I will open it back up to our speakers to respond to. So Isabel, let me just pull up your slides really briefly. Isabel, are you there?
Yes, thank you very much. Thanks, Lindsay, and thanks, Khalid, for your presentation. So my name is Isabelle Quentin, and I work for UNICEF EPRO, the regional office. So I just wanted to introduce you to the initiative that we put in place in our region. And what motivated us is, everything that's been discussed previously, and, with a lens of trying to reduce this burden of waste that was created by COVID-19 and probably, what was before. So what influenced us are those three different guide. There was this guide from Global Analysis of Healthcare Waste in the context of COVID-19. The next guide, next slide, which was the COVID-19 vaccination supply and logistic guidance that was written by UNICEF and WHO. And the next one, of course, that was presented as well by UTE, so the review on technology for treatment. So next. So what we decided to do, we wanted to put in place a tool that would help countries in making better decisions in choosing treatment technologies according to their context. So we were aiming, at trying a solution to help them reduce the unsafe risk to the health workers, reduce exposure to dioxin and furans and other dangerous emission to the environment, reduce the waste volume, and of course have all of this in a bundle service, such as having, installation included, training, 2 years warranty on the equipment, and some spare parts that would be available, but in country into our region. So with all that, next, we decided to do, first we did a research which started in April 2022, where we published a request for information, and we gathered all information from 22 different manufacturers and suppliers. And then March 2023, a year later, then we published a request for proposal where we were asking only manufacturers, what can you propose to UNICEF to help countries treat their waste? And out of that, in November, we have sent letters to award long-term agreements with only 5 suppliers and for 3 very distinct products. So every product, every machine technology includes a shredder, and we're looking at microwave solutions, autoclaves, and frictional heat. So very shortly, those will be signed and will be announced to publish those 5 suppliers. It's being done right now. It should be finished by the end of the year. And this should help our countries in the region to procure the right equipment and technology. Thank you.
Thank you very much, Isabelle. And if I can ask all of my speakers to turn their video on, it looks like we have a robust chat, and you've just heard a number of different experts talking about their work on healthcare waste management, from guidance and recommendations to project specific, from the procurement of technologies all the way to digitizing and addressing the abundance of waste. Uta and Vidya, if you can turn on your videos for us, if possible. Fantastic. So I'm going to put a few questions out there. If any one of my speakers is burning to answer a question, please feel free to jump in. But Uta, I want to start with you. It seems we have a couple questions here that's pointing to the availability of these technologies in low-income, low-resource settings. Maggie Montgomery is asking about the use of autoclaves, new autoclaves in low-resource settings. Robert's also asking about how economies with slightly lower technology could achieve similar impact. So I wonder if you want to first touch on that, and then I'd like to see if Manish or Vidya or Isabelle has any additional thoughts from their experiences.
Okay, thank you for all the questions I've seen. Well, actually, like I mentioned, the selection of treatment technologies is quite difficult, and it's really depending on a lot of factors. It will not be possible to find one solution, like Lindsay also mentioned, for everything. and it will not be possible to install alternative treatment technologies in all and every settings. But first of all, as this is a preferred option, and this series is about green technologies, these options need to be considered, and I think we have the responsibility to highlight these possibilities as options. And maybe this is not possible now, but it might be possible in future, especially when we are planning on that in future as well. I can just tell you an example from Tajikistan, which is also kind of answering Maggie's questions. It's not at the moment, microwaves are quite coming in the waste management sector, because they don't need much water, and this is a big advantage for microwaving. It's not only the water, but also the quality of water, which is in a lot of countries really a difficult issue. And in Tajikistan, I'm working in Tajikistan since more than 10 years now. And at the beginning, it was only incineration. There was no way around. And we installed the first autoclave. And when we installed it, at the end, the head of the hospital came to me and said, "Yeah, but I want to have it burned. It's not burning." It's kind of, and today, the Ministry of Health has really changed their mind, and they are going more and more for alternative treatment technologies. They are asking also the donor organizations to provide alternative treatment technologies. And so in Tajikistan, some microwaves have been installed, mainly in Dushanbe, in the capital at the moment. But they are making really good experiences with that, although we have to wait a bit longer to see how the maintenance, the operation in future will be covered, because of course, like you might know, Tajikistan has difficulties with their resources, and it will be an issue also in future. But I think things are really changing over time.
That's really helpful to hear. And I think your point about sensitization is really critical here as we come on board with rather technical solutions. I think being supportive of our non-technical counterparts, the decision makers, to understand what the options are. And like you said, if it's not a choice for now, how we can think about it down the road, particularly as facilities are becoming equipped with water and energy. How we would make sure that that would be sufficient for the needs of green technologies in the future. Isabel, and then Manisha Vidya, did you have anything you want to comment about low resource settings and the context that you've seen?
Yes, and actually, I'd like to mention as well that at the regional office, we're working on guidance right now that's going to help countries in making decisions on what type of technology would be best for their setting. So we developed a guidance, and with the help of the suppliers as well, to really determine, what's best for a country. And I see there was question as well about wastewater, coming from those technology. And, when we talk about those technology that have the shredder included, it's in one vessel, and the water that's being used is actually being treated as well. So the wastewater that's coming out of those technology are not infectious at the end of the process. It has been treated during the whole cycle. A cycle to treat those waste is about 30 minutes to 45 minutes for the small capacity ones, being longer with the bigger capacity machines. But and the cost, like we've done a study as well on operation and maintenance costs for each one of those technology. They run about, autoclaves been about 14 cents US per kilogram that you're treating, to the microwave and frictional, which are 13 cents. Incineration, we actually found, was 27 cents. So double the price on operation and maintenance to operate an incinerator versus autoclave and microwave. So we have this guidance that will come soon in 2024. It will be made public, obviously. And you'll see that actually there are a lot of advantages to those new technology. Of course, the cost upfront is an investment, but in the long term, it seems to be really worth its while.
Thanks, Isabel. Vidya or Manish, any other comments on this question? You're on mute, Manish.
Yeah, go ahead with go ahead.
No, go ahead, Manish.
Yeah, I mean, from UNDP perspective, I agree with what the other panelists have said in terms of choosing the technology and the trade-offs between energy and the quality of waste management. From UNDP's perspective, one of the things we are doing globally, as was also demonstrated in the Madagascar example, is a focus on smart health facilities with smart energy solutions and sensor-based technologies to at least address the energy needs. So we have worked across health facilities, I think in about 12 or 13 countries, setting up solar equipments and technologies, and then sensor technologies and dashboards. So you are able to assess the energy consumption and assess the energy efficiencies in these health facilities. So at least one aspect of a clean energy, reducing the carbon footprint for healthcare waste management is to try and see where resources allow and governments are agreeable to move to solar technologies as one of the solutions.
Fantastic. Vidya, anything on your end?
Yes, I'm saying that one of the questions in the chat that whether we only focus on infectious waste, that's the priority asked by the government, but in next or in the near future, we also would like to see also the non-infectious ones. So, yeah.
Yep, great point. And I see that comment in there. I have a great question, two great questions actually here. The first one from Adam about looking the work with the ministries of health as we're making them increasingly aware or prioritizing this issue. It sounds like internally from our organization's perspective, COVID was a big turning point in the conversation of waste management. But can you speak to how the ministries of health are becoming more aware of this, and what evidence or factors from case studies has been most resonating? Maybe I'll actually do this in reverse. Manish and Vidya, from your work with Indonesia, can you speak to what has resonated with the Ministry of Health to prioritize this topic?
Yeah, I think Vidya, being based there with the UNDP country office, will of course be able to give more details. But what I have seen is that from a higher perspective, from a digital perspective, the system, the SME-Smile system integrates or aims to integrate with the national digital platform. So it's not a siloed app that is working on its own. The idea is to integrate this with the national digital platform of the health ministry. So it is interoperable. And the other big thing which Vidya presented, which really resonated with the ministry, was that before digitizing any public health program, be it healthcare or any other, waste management or any other, the standard operating procedures are critical, and these are the non-digital component. And we actually had a 4-day workshop in Bali, where we sat with the health ministry and went in details across every point of the waste management across its entire life cycle. And once you have that, then digitizing or layering a digital layer over that is easier. And I think that is one of the key lessons. And of course, the third relevant element is that when you're designing the digital technology for any program, as long as it empowers the last mile health worker, they will adopt it. So when Vidya was presenting 100% adoption and data entry, it was because the user interface is simple enough, and the health worker or the sanitary worker in these facilities feels empowered that his or her job is is being recognized, and they're able to perform gain efficiencies. Yeah, and over to Vidya for more.
Yeah, I think this is because of the responsibilities was divided between two ministries. So I think that in the beginning, they're silo, they're not talking to each other. So this is why the Ministry of Health would like to have a control as well, or visibility on what the waste generated by their hospitals is being disposed well, or properly. So this is one of the key things that the government or the Ministry of Health would like to see from this monitoring tools. Yeah.
That's great, Vidya. And I think that siloing piece comes up again and again in this line of work. So I think returning to that and thinking about how we can broker those relationships and bring the conversations to the table is really going to be critical to coming up with a collaborative plan. One or two more questions here I want to try and squeeze in before we close. Uta or Isabel, there's a question here about life cycle costs for non-burning technologies. And I wonder, in the work that you both have done, if you have found any studies or have any data on this. So I think
actually, as I know that Isabel is currently working on on that, so she will have more information on that. But what we did also in the framework of this UNDP GEF Africa project is to do a comparison calculation of the different autoclave types in different countries, including also the consumption, the electricity consumption, human resources, infrastructure, maintenance, and everything. So there is an Excel sheet available on the green. Oh, what's the name of this webpage? I will post it in the chat. So that you will find an Excel sheet with these comparison, which is available publicly, and so and there you can see that it's really important to see the whole system, not only the investment, but also the infrastructure, the maintenance of infrastructure, the electricity, also human resources is a big issue, the disposal afterwards, and so on. So I think all these factors need to be considered. But I will hand it over to Isabel as well.
I don't have like an actual whole cost. I haven't done the study in detail, so I don't know how I could answer this question at this moment.
No, that's helpful to hear, and it sounds like that might be of interest down the line as people are more effectively using the green technologies and they become more prominent, particularly in the low-income, low-resource settings. Just a note, I do see a couple comments here about pharmaceutical waste. And if I'm not mistaken, Uta, that's something that you are thinking about in the future. Nothing to present on at this moment, but it is something that WHO is aware of. Is that correct? Oh, you're on mute. All right, we'll give you a second as you go find that link for us. But I believe that is an area that's being looked into. So this comes to the conclusion of all the presentations. I want to thank our presenters for your great contributions. As you can see from the chat and the questions, there is a lot to learn about healthcare waste management. We have a lot of skill building to do on this topic and information sharing as we do more work and actually implement. And particularly grateful to our colleagues in Indonesia for sharing your work. I think it really helps to put these guidance into practicality to understand what's working. I want to take a moment. I did open the chat. It looks like I don't know if it was working earlier, but if you'd like to use the chat to just drop in any additional resources that would help you work on healthcare waste management. Do you want more webinars on specific topics? Are you looking for more case studies that are written up? Do you think workshops on this topic would be useful? What would be most valuable for you? Just take a moment and drop any thoughts you have in the chat. We do want to continue to support all of you in working on this issue. There's about 70 of us on today, and I'm sure we'll have more people viewing this after the fact. In addition, if there's specific topics within healthcare waste management you're particularly interested in, I've seen some comments in the chat about non-infectious waste Operations and maintenance, I think, is always a big question. Mention of reverse logistics in here, and how that would work. Practical guidance on minimization of healthcare waste would be beneficial. That's fantastic. I think we can think about how we would talk about recycling as well, and the full waste management cycle, not just the technology end of things. As a reminder, some of those materials are available through the WashFit tool. So if Arabella could just drop the link to WashFit in the chat, please be sure to check out the WashFit guidance document and the associated resources. There's a technical brief on waste management, and that can certainly start your reading, as well as the guidance documents that Isabel and Ute talked about from WHO that spurred UNICEF to take action. Certainly might be worth taking a look at yourself, etc. So thank you all for the time. I'm going to go ahead and close this. Again, thank you to my fantastic presenters for sharing your work here. And we'll be back with the next session in the technical webinar series in 2024. It'll either be on costing and solarization, but stay tuned in your email. Thank you so much.
Thank you, Lindsay, for leading us through. Bye-bye.
Thank
Thank
you.
you all.
Thank you.